For millions of people living with diabetes, insulin is more than just a medication. It's a lifeline. It helps control blood sugar, prevents complications, and makes it possible to live a longer, healthier life. But as powerful and life-saving as it is, insulin can also cause side effects that range from mildly uncomfortable to potentially life-threatening. The challenge is that some of these side effects can be easy to dismiss or confuse with everyday issues. A little dizziness might be blamed on fatigue. Unexplained swelling could be written off as aging, but sometimes these subtle changes are your body's way of warning you that something isn't quite right with your treatment. In today's video, we'll explore 7 of the most important side effects of insulin you should never ignore. You'll learn what each one feels like, why it happens, and the red flags that mean it's time to call your doctor. This is not about scaring you away from insulin. It's about empowering you to use it safely and effectively so you get the benefits without unnecessary risks. If you're over 50, paying attention to these signs is especially important. As we age, our bodies process medications differently, and reactions can be more intense or happen faster. Knowing what to watch for can help you stay healthy, active, and confident in managing your diabetes. Let's start with the side effect that can appear suddenly, progress rapidly, and become dangerous if ignored. Low blood sugar or hypoglycemia. Check 1. Low blood sugar, hypoglycemia. Low blood sugar or hypoglycemia is the most common and potentially the most dangerous side effect of insulin. Because insulin's main job is to lower blood glucose, taking too much or having it work too strongly can cause your levels to drop below what your body needs to function. This can happen if you inject the wrong dose, skip or delay a meal, exercise more than usual without adjusting your insulin, or drink alcohol on an empty stomach. The early signs of hypoglycemia are usually easy to recognize if you know what to look for. You might start to feel shaky, sweaty, or suddenly anxious. Your heart may race, and you could notice hunger that comes on intensely and unexpectedly. As your blood sugar drops further, symptoms can include blurred vision, confusion, difficulty speaking, clumsiness, or a sense of weakness that makes even standing difficult. If hypoglycemia isn't treated quickly, it can become severe, leading to seizures, loss of consciousness, or in rare cases, death. Older adults are particularly vulnerable because their warning signs may be less obvious, and their bodies can take longer to recover once sugar levels drop. The best way to treat mild to moderate hypoglycemia is to follow the 15-15 rule. Consume 15 grams of fast-acting carbohydrates, such as glucose tablets, a small glass of juice, or regular soda, then wait 15 minutes and check your blood sugar again. Repeat if needed until your levels return to normal. For severe hypoglycemia, where a person is unable to swallow, an emergency glucagon injection may be necessary, and medical help should be called immediately. Prevention is just as important as treatment. Always take insulin exactly as prescribed, never skip meals after an injection, and keep quick sources of sugar within reach at all times. If you start noticing frequent low blood sugar episodes, tell your doctor your insulin dose or timing may need to be adjusted. Hypoglycemia is one of the clearest examples of why being informed about insulin's effects is so important. Recognizing the signs early and acting fast can prevent a dangerous situation and help keep your treatment safe and effective. 2. Weight gain. Weight gain is a common side effect of insulin therapy, and while it's not as immediately dangerous as low blood sugar, it can affect long-term health and diabetes management. Understanding why it happens can help you take steps to manage it effectively. When you start using insulin, your body is able to process and store glucose more efficiently. Before treatment, high blood sugar often leads to glucose being lost through urine, which can result in unintended weight loss. Once insulin therapy begins, your body holds on to those calories instead of losing them, which can lead to gradual weight gain. Insulin also promotes fat storage. When you have more insulin circulating in your body, it signals your cells to store excess glucose as fat rather than burn it for energy. Over time, especially if your calorie intake remains high, this can lead to noticeable weight increases. Another factor is hypoglycemia prevention. If you frequently experience low blood sugar, you may eat extra snacks or sugary foods to bring your glucose levels back up. While necessary in the moment, these extra calories can add up quickly if you're not adjusting your overall diet. The weight gain linked to insulin doesn't have to be dramatic to cause issues. Even an extra 5 to 10 pounds can impact blood sugar control, blood pressure, and cholesterol levels. This can make it harder to manage your diabetes and increase the risk of heart disease over time. To minimize weight gain while using insulin, focus on balanced, nutrient-dense meals that help keep blood sugar steady without excessive calories. Include plenty of vegetables, lean protein, and healthy fats, while limiting processed carbs and sugary snacks. Regular physical activity, even light walking after meals, can help your body use glucose more effectively and reduce fat storage. If weight gain continues despite your best efforts, talk to your doctor. They might adjust your insulin dose, change the timing of your injections, or recommend combining insulin with other diabetes medications that are weight neutral or promote weight loss. Insulin is essential for many people, and weight gain shouldn't stop you from using it when it's needed. The key is awareness and small, consistent lifestyle adjustments that help you balance blood sugar control with a healthy weight. 3. Injection site reactions, redness, swelling, lumps. Since insulin is delivered through injections, it's not surprising that some side effects occur right where the medication enters your body. These injection site reactions are fairly common and can include redness, mild swelling, itching, tenderness, or even the formation of small lumps under the skin. In most cases, these reactions are harmless and go away within a few hours or days. They often happen because the needle irritates the skin or because your body is responding to the insulin itself or to preservatives in the solution. However, if the same spot is used repeatedly for injections, a condition called lipohypertrophy can develop. This is when fatty tissue under the skin thickens, creating firm lumps. Not only can this affect the appearance of your skin, but it can also interfere with how insulin is absorbed, making blood sugar control more unpredictable. Less commonly, some people develop lipoatrophy, which is a loss of fat tissue at the injection site. This can leave small dents or depressions in the skin. Both conditions are linked to repeatedly injecting insulin in the same area, which is why rotation of injection sites is so important. To reduce the risk of reactions, always use a fresh needle for each injection, make sure the insulin is at room temperature before injecting, and clean the skin gently with alcohol before use. Rotating between different areas such as the abdomen, thighs, buttocks, and upper arms, gives each site time to heal and helps maintain smooth, healthy skin. If you notice persistent swelling, severe pain, or signs of infection like warmth, pus, or fever, contact your doctor promptly. These could indicate an infection or an allergic reaction that requires treatment. Injection site reactions are one of the easier insulin side effects to manage because small changes in technique can make a big difference. By being mindful of how and where you inject, you can minimize discomfort, keep your skin healthy, and ensure your insulin works as effectively as possible. 4. Allergic reactions, rash, swelling, breathing difficulties. While allergic reactions to insulin are relatively rare, they can range from mild skin irritation to life-threatening emergencies. Because insulin is a protein-based medication, the immune system in some people may react to it as if it were a harmful invader. Reactions may be triggered by the insulin molecule itself or by additives used in the preparation, such as preservatives or stabilizers. Milder allergic responses often show up as skin rashes, redness, or itching at the injection site. These symptoms might come on within minutes or hours of an injection and usually fade on their own. However, when these skin changes are persistent or spread beyond the injection area, they should be evaluated by a doctor. More serious reactions can involve angioedema, a sudden swelling of the face, lips, tongue, or throat. This swelling can quickly block airways, making breathing or swallowing difficult. In the most severe cases, an allergic reaction can escalate into anaphylaxis, a medical emergency that may cause a rapid drop in blood pressure, dizziness, fainting, and loss of consciousness. Without immediate treatment, usually an epinephrine injection, anaphylaxis can be fatal. Another possible allergic manifestation is generalized hives, which are raised, itchy welts that appear on different parts of the body. While hives themselves are not life-threatening, they can be a sign that the immune system is on high alert and that more severe symptoms could follow. If you suspect an allergic reaction, stop using insulin and seek medical attention right away. For mild reactions, your doctor may recommend antihistamines, corticosteroid creams, or switching to a different insulin formulation. For severe reactions, emergency treatment is essential. Importantly, an allergic reaction can happen even if you've used insulin for years without problems. Sensitivity can develop over time, so never ignore new or unusual symptoms. Keep track of any changes after injections, and don't hesitate to contact your healthcare provider if you're concerned. Although allergic reactions to insulin are uncommon, knowing the signs and acting quickly can be life-saving. Awareness is your first line of defense, ensuring that insulin continues to be a safe and effective part of your diabetes management plan. 5. Low potassium levels. Hypokalemia. One of the lesser-known but important side effects of insulin use is low potassium levels, a condition called hypokalemia. While it's not as common as low blood sugar, it can still pose serious risks if it's not recognized and addressed quickly. Insulin lowers potassium levels because it drives potassium from the bloodstream into the body's cells, along with glucose. This is normally a beneficial process as it helps maintain proper cellular function. However, if too much potassium is shifted out of the blood, especially when insulin is given in high doses or during intensive treatment, blood potassium can drop below the healthy range. Mild hypokalemia may cause vague symptoms such as muscle weakness, fatigue, or mild cramps. These signs are easy to overlook, especially in people who are already dealing with diabetes-related tiredness or other health issues. As potassium levels fall further, symptoms can become more noticeable. Muscle twitches, constipation, irregular heartbeats, or a feeling of heart fluttering in your chest. In severe cases, hypokalemia can lead to dangerous heart rhythm disturbances that require immediate medical attention. Certain people are at higher risk, including those taking diuretics, water pills, people with kidney problems, and those who have been ill with vomiting or diarrhea. Combining these factors with insulin therapy can make potassium depletion more likely. If hypokalemia is suspected, your doctor will likely order a blood test to confirm the potassium level. Treatment may involve potassium supplements, dietary adjustments to include more potassium-rich foods like bananas, spinach, and sweet potatoes, or changes to your insulin regimen. In severe cases, potassium may need to be given intravenously under hospital supervision. Preventing low potassium starts with awareness. Regular lab checks, especially if you have other conditions or take multiple medications, can catch the problem before it becomes serious. Maintaining a balanced diet, staying hydrated, and reporting new symptoms promptly are simple but effective ways to protect yourself. While hypokalemia isn't the most common insulin side effect, it's one of the most critical to address because of its potential impact on heart health. Keeping potassium levels in check ensures that your body can safely benefit from the blood sugar-lowering effects of insulin without unintended harm. 6. Edema, fluid retention, swelling in legs and ankles. Another side effect that some people experience while using insulin is edema, or fluid retention. This typically shows up as swelling in the legs, ankles, feet, or sometimes even in the hands. For some, it's mild and mostly a cosmetic concern, but for others, it can cause discomfort, heaviness, and reduced mobility. Insulin can contribute to edema in a few ways. When insulin therapy begins and blood sugar levels improve, the kidneys start holding on to more sodium and water. This shift can cause fluid to build up in the body's tissues. Additionally, insulin has a direct effect on the blood vessels and kidneys that can encourage water retention. In some cases, edema appears shortly after starting insulin or increasing the dose, and may gradually improve as the body adjusts. Mild swelling often appears at the end of the day, especially if you've been on your feet for hours. You might notice your shoes feeling tighter or sock marks on your ankles. In more pronounced cases, the swelling can be visible as puffiness, and pressing on the skin can leave an indentation that lingers for a few seconds. a sign known as pitting edema. While mild edema is usually harmless, it can sometimes be a sign of other issues, such as heart failure, kidney problems, or liver disease, conditions that are more common in people with diabetes. That's why persistent or worsening swelling should never be ignored. To help manage edema, try elevating your legs when resting, wearing compression stockings to support circulation, and limiting excess salt in your diet, which can worsen fluid buildup. Staying active throughout the day also helps improve circulation and reduce swelling. If the swelling is sudden, severe, or accompanied by shortness of breath, chest pain, or rapid weight gain, seek medical attention immediately. Your doctor may need to adjust your insulin dosage, review your other medications, or run tests to rule out underlying conditions. Edema may not be dangerous on its own, but it's an important signal from your body that something is changing. By recognizing and addressing it early, you can keep your treatment plan on track and maintain both comfort and safety while using insulin. 7. Vision changes. Vision changes are another side effect that can occur with insulin therapy, and they can be unsettling, especially if they happen suddenly. While insulin itself doesn't damage your eyes, the way it changes blood sugar levels can temporarily affect your vision. When you begin or adjust insulin treatment, your blood sugar levels often drop from consistently high numbers to a healthier range. This shift changes the fluid balance inside the eye, particularly in the lens, which can cause it to swell or change shape. As a result, your ability to focus may be affected, leading to blurred or hazy vision. This type of vision change is usually temporary and tends to improve once your blood sugar levels stabilize. However, in some cases, vision changes can be a sign of more serious problems. People with diabetes are at increased risk for eye conditions such as diabetic retinopathy, macular edema, cataracts, and glaucoma. These conditions can worsen if blood sugar levels swing too quickly or remain poorly controlled over time. It's important to note that not all vision changes are mild or temporary. If you experience sudden vision loss, flashes of light, dark spots, or a shadow or curtain over part of your vision, you should seek immediate medical attention. These could be signs of retinal detachment or severe bleeding in the eye, which require urgent treatment to prevent permanent vision loss. To protect your eyesight while using insulin, aim for gradual improvements in blood sugar rather than drastic drops, and monitor your levels regularly. Schedule comprehensive dilated eye exams at least once a year, or more often if your doctor recommends it. This allows any changes to be detected and treated early. If you notice mild blurriness after starting or changing your insulin dose, give your eyes a couple of weeks to adjust, but still let your healthcare provider know. They can determine whether it's a normal part of the adjustment process or a sign of something more serious. Vision is one of our most valued senses, and preserving it should be a top priority for anyone with diabetes. By understanding how insulin can affect your eyes and acting quickly when changes occur, you can reduce the risk of lasting damage and keep your sight clear for years to come. Insulin is a life-changing and often life-saving medication for people with diabetes. But like any powerful treatment, it comes with potential side effects. In this video, we've covered 7 key ones you should never ignore: low blood sugar, weight gain, injection site reactions, allergic responses, low potassium levels, fluid retention, and vision changes. Each of these can range from mild and temporary to serious and urgent. And the key to staying safe is recognizing the signs early. The most important takeaway is that you should never stop insulin on your own, even if you suspect it's causing problems. Instead, track your symptoms, note when they occur, and share this information with your healthcare provider. Together, you can adjust your dosage, timing, or even switch to a different formulation if needed. For those over 50, paying attention to these side effects is even more critical, since the body can be more sensitive to medication changes and recovery may take longer. Alongside regular blood sugar checks, keep up with routine lab work, annual eye exams, and healthy lifestyle habits to reduce risks. If you found this video helpful, please give it a like, share it with someone who could benefit, and subscribe to MediMint for more clear, trustworthy health information designed especially for people over 50. Staying informed and proactive is the best way to get the benefits of insulin while protecting your long-term health.